this skill, we're going to talk about nail care and foot care. When you do foot care for a patient, they can be in bed, but if they're able to be in their wheelchair or another chair, it's a little easier for you not to spill water. So the first thing that you want to do is get water in your basin and make sure they check the temperature of the water to make sure it's a comfortable temperature for that. The next thing that I'm going to do is I'm going to go ahead and I'm going to take a towel and use that as my barrier for on the ground. If you're going to do foot care, you can do their feet separately or get two basins and do them at the same time. Next thing I'm going to do is I'm going to take my basin, I'm going to put it underneath, and I'm going to have my resident put their foot inside this basin. Again, if I put their feet together, I can do both of them, but I'm just going to focus on one foot for purposes of this video. If a foot needs to be soaked in water, if you're doing foot care, the foot should soak for 15 to 20 minutes, okay? So I'm going to start with soaking the feet. I'm going to have my supplies ready for that, and then I'm also going to go ahead and do nail care at the same time for this video. When I do nail care, I'm going to use this kidney basin, and I'm going to have water put in it for the patient, and I'm going to put this in front of the patient. So these over the bed tables are very nice because I can just put this right over top of everything that I'm already working on. So I can go ahead and my patient can go ahead and put their hands inside this basin and could hold it inside this basin for the 5 to 15 minutes that nail care needs to be soaked for. After their fingers have soaked for that amount of time, I could get my towel here and I could dry their hands. I could use this wood stick that has a flat side that I like to use better than the pointed side, and I could clean underneath their nails to make sure they're all clean. I could use the clippers and cut straight across if I needed to clip their nails. Or I could also use an emery board and just file their nails when they're nice and soft and soaked. That's the nice thing about soaking fingernails, is that it makes them nice and soft and easier to trim up. So I could file them. When I have that all done, everybody loves a little lotion, put a little lotion, and you can lotion their hands up as well. So because the fingernails only take 5 to 10 minutes to soak, and the feet take longer, we do those first. Once I'm done with nail care, I can disinfect everything and put them back. I can move this out of the way and I could go ahead and work on my foot care then. So for foot care, I have my other supplies, and I'm just going to leave them on this table where I could reach them. So I'm going to go ahead, I'm going to get down. Remember, when you're working with residents, your knees should never touch the ground. If they have to for some reason, you make sure that you have a barrier, paper towel or towel, so I can use that so that I don't have any germs from the floor on my scrubs. When I'm doing foot care then, so the foot has soaked for that amount of time, I can go ahead and do foot care. So I'm going to get my soap and a washcloth here. I'm going to get my washcloth wet. I'm going to put my soap on there. And then I'm going to go ahead and I'm going to wash the foot. Okay? So I'm just going to wash the whole foot. I'm going to wash in between the toes. Sometimes just kind of floss the washcloth in there. And then I would put this in my plastic bag. I can put the foot back in there then, and I can get my rinse washcloth and just rinse everything off. When I rinse, I also rinse in between the toes. At this point, I'm going to go ahead and move my basin out of the way. And then I can dry the foot. When I dry the foot, I'm also going to dry in between the toes. You can put lotion on the foot. You should always lotion the feet. You can put lotion on the foot. You just want to make sure that you do not put lotion in between the toes. This is a dark, moist, warm area, and you don't want any microorganisms to harbor there and cause infection. Then you would be able to put on their socks and their shoes so that the foot care is already done. And that is the conclusion for foot care and nail care.